I am Jose Maria Aguilera. I am a surgeon, a plastic surgeon and vascular surgeon. I am alumni of the doctorate program at the Knowledge University at São Paulo. And today I'm going to talk about biophotonic assessment and diagnostic criteria of foreign body reaction due to biopolymers and laser treatment on gluteal and facial region. We're going to show a little pilot study of clinical cases. This all for making clear that the only purpose of this article or this work is just sharing knowledge, and we have no conflict interest on this article. In the definition of biopolymers, we have different natural origins about this substance. Can come from animals and also plants. And all these have the capacity of form hydrogels. So when we want to modify an anatomical area and give some volume or determine the shape, we use the biofillers in order to modulate or make an harmonization of that part of the body. So we can say that in the total amount of biopolymers, we have the biofillers. That the source can be natural, as the cellulose of hyaluronic acid, or synthetic, like the silicone or polymethyl methacrylate and other oil. So in order to make even more simple the scheme for this explanation, we can separate the human analog substance like hyaluronic acid, collagen, and calcium hydroxyapatite, and non-human substance like silicone, polymethyl methacrylate, sodium hyaluronate, with or without polyethylene glycol. The foreign body reaction is when you deliver some foreign substance inside the human body, and the phagocytical system is trying to englobate in order to provoke a fibrosis reaction over this kind of substance. And we see that there are involved so many molecules and so many cells in order to try to mitigate the effect of that body, that foreign body. Also, we can see here that the foreign body reaction starts with the complement cascade activation and of the C1 complex, passing for C2, C3, and provoke a swelling cells and burst that try to converge in order to phagocytate the foreign body. The foreign body is a substance who have recognized by the body as has himself made. So at the time that we see the effects, we can see when we activate the dendritic cells or when we suppress the dendritic cells, that have different connotation in order to see that express more molecules of inflammatory cytokines or non-inflammatory cytokines in order to be accepted or be rejected for the human body. As we start to study this kind of biofillers who are used most of the time for aesthetic purpose, we see that in some cases we have a large reaction in order to establish a syndrome criteria, like for example fever, arthritis, dizziness, arthralgia, alteration of the cognitive functions, loss of memory. So we have a major and minor criteria to establish the diagnosis of Asia syndrome, who is an exacerbated immune response in order to react against that biofiller. So we can see the organs will be targeted by this reaction, this syndrome. It can be affect the heart, can be affect the skin, the bones, and also nervous tissue. In the bones, the most frequently is because we see that in this kind of reaction, the body take out the calcium from the bone in order to maintain the pH of the blood. So to contrast the acid medium, they take calcium from the carbonate of calcium and in form of calcium ions to maintain a buffer effect in order to maintain normal the pH of the body. So at the moment of the assessment, we can see that multispectral infrared thermography in 3D reconstruction are very useful because we use a little thinner window that the infrared spectrum in order to see the quantum thermodynamics of the emission of radiation of the human body, and we trying to detect some alterations or some tissue dysfunctions, as well as inflammations, neurological patterns, vascular patterns. We can even see carcinomas very early with the cell dysfunction with this emission. Why we use the multispectral thermography joined with the CT scan and the double ultrasound? We see that there is physiological and we can topographically study the biofillers. We can see there is a tissue dysfunction that it could be chronic or acute. If there is some probability of migration of the biofiller and what going to be the organ target of this failure, or there is in failure or not. We have a great possibility of surgical removal. There is nerves and vessel involved. Also, how can be our surgical scar that we made at the time the remotion. It's possible to do the reconstructive surgery in the same surgical time, or we have to postpone due to patient comorbidities. How is the volume? We have to take it out and establish the surgical approach, the surgical technique, and also trying to choose the better wavelength absorption due to the nature of the material that the patient have inside. So we analyzed 3 years case of 27 patients, all females, 27. 18 were operated just once in one surgical time. An acceptable amount of biofiller removed. We're talking about over 400 cc until almost 1 liter. Very good post-surgical evolution, and all the symptoms disappear post-surgical. And we see 33% of the patients who need more than 1 or 2 reoperations since the first operation in order to take it out that symptoms will bring up to the consultation. We don't have any intrasurgical complication. None of the patient need intensive care unit admittance, and no one patient have a secular status after the post-surgical procedure. That's why this is the way that we plan the surgery. We see this graphic is the wavelength versus the absorbance. We can see at the line of the 980 nanometers and 1064 nanometers, we have a peak of absorbance absorbance. And we can see also that we use saline solution at 30 degrees. We have a very high peak of absorption. That means that we have to engulf all the foreign body in order to pass light through these underwater adhesion in order to denaturalize these bonds or links inside the molecule. So the photothermolysis must be under a sodium chloride solution, and the wavelength more acceptance are 980 nanometers and 1064 nanometers, and less common 4030 nanometers. This is an example of I brought you 3 examples of 3 cases. This first patient have come for a very severe pain with polyarthritis and gluteal leg paresthesia, also a myoparesia of the lower limbs. We can see at the multispectral infrared image that we see how this color represent a cell's dysfunction, and these cells, in terms of thermodynamical quantum values, are cells who have not accumulated the ATP synthase, in order that we have hypoxia in that tissue. Surrounded by other areas, there are more inflamed and with edema. So we can see in the 3 axes here how can we receive the information, and we start to reconstruct in order to understand better the inner process who is passing through. The same patient with a different angle. So we see where is the cell dysfunction. We don't recognize this pattern as colors. We recognize this pattern as dysfunctional cells who doesn't have a good ATP accumulation. So our technique will be now not to make rachital or general anesthesia. We work with ultrasound guided blocked nerves and also the vessels in order to avoid an hemorrhage complication. Also, we have to have a mild sedation in order to be able to evaluate the Glasgow score to see if there is an embolism or how will be the neurological and cardiovascular response during the procedure. That means all the procedure is done in local anesthesia, and the patient, it doesn't feel pain at all. This is how we mark with the ultrasound guide to see where we're going to establish the block and how we have to engulf the foreign body in order to make the photothermolysis. The photothermolysis can be varied. That's why I didn't bring to you a scheme in order to treat, because all depends of the amount of the substance who's going to be removed, the wavelength they will be working on the photothermolysis, as well, and the amount of joules. It can be from 1,000 joules until 8,000 joules for gluteal region. In facial region, we can reach the 1,500 or 2,000 joules. This is the aspect of the entrance of the skin. We don't do incision more than 5 millimeters, which is very different of the traditional way of removal of the foreign body, who is extensive incision. with scarring, which is very terrible for the patient. We can see once it's melted on the photothermolysis, we see how the substance, in this case, polymethyl methacrylate, we take it out, and how would you wait for a little bit time and the liquid start to solidify in these pieces. In this case, we are able to reconstruct the gluteal region, grafting stem cells from the adipose tissue, and this is a post-surgical image of 2 weeks after the reconstruction. The patient was satisfactory recovery. At the average time of admittance post-surgical time is 4 to 6 hours, and the patient is under discharge and with no complications. And this is the image of 2 weeks, how we can see how much improved the signal, and that means the tissue is already oxygenated, and the ATP accoupling is now enabled and working good. So we don't have more ischemic areas. And that's why we do the hypermax in 3D reconstruction, in order to see there is some remaining foreign body, how we're going to treat, there is able to treat or not. This is also see on the other positions. So the patient had a good recovery. This is other case. This is one patient of 30 years old. She have a systemic erythematous lupus under treatment, and also the foreign body migrates to a heart valve and affect their cardiac function. We can see here how we can see the tissue dysfunction and the tissue hypoxia caused by the biofiller, and how we can see this on the 3D reconstruction hypermax thermography image. Same time, the same patient from the other point of view, and how we do the reconstruction. So at this case, we can see here the siliconomas and the mix with polymethyl methacrylate, and we can see here how the mitral valve was damaged because the migration of this substance. Same case, we do the entrance, and we see how we perform the lacing process under ultrasound guided. We can see how it's going out, and we can see here how it's melted and desuctioned, avoiding these big scars. This is the aspect of the 2 weeks patient, the same patient. But you can see there is still a foreign body remaining in other part, but the most difficult part, it was going well. So in this case, we were not able to make the reconstruction because all the comorbidities the patient had, and we consider it very dangerous for the patient and to face some surgical complications. We can see that we improve the area, but we cannot take it out all the foreign body. And in a percentage, we almost take it out, arise the 70%, but we can reach 90%, but we can't take it all because when some of the biofiller stay very close to the arteries, the veins, and the nerves, we are not able to touch this area more than 2 millimeters closer because the risk of damage, the vascular damage and the nervous damage. This is the look how we stay after. The skin color is much better. They're not cyanotic, and the patient the patient C is able to walk again, all the pain disappear, and have no complaints, and his heart function stay well after the procedure. This is other case in face that we see that after an injection of hyaluronic acid for renomodulation procedure done by a plastic surgeon, after 6 hours, the patient starts to feel nasal pain, great nasal pain. After that, the nasal skin starts to be dark, and in 36 hours, she had a complete nasal tip ischemia. So, team of plastic surgeons made the reconstruction with a skin graft from the post-auricular skin area, and we see how it stay here. Particularly, I would prefer to do a flap, but the team would prefer to do the complete skin graft after this. At the moment that the colleague refers to me in order to improve his scars, his nasal scar, for the laser treatment, we take a thermography of the face, and we can see there's still not complete vascularization of the flap. So if we practice laser at that time, we're going to lose all the skin that it was grafting. So we tell to the patient to come 30 days later in order to see if there is a vascular improvement. And 30 days after, we see how much the vascularization are improved, and it's safe to do laser on his scars. So we can see after 2 treatments of 30 days, we're talking about 2 sessions in 50 or 60 days, we see how much the skin improved after this, and all was saved, and the patient get very happy with the results. So the discussion is we can see the approach of the multispectral thermographic image in order to. It's a very good tool to have assessment of the first assessment. Other thing that all the team that they have to be involved with the interpretation of the thermographic image, also the Doppler image, must be all the team, since the plastic surgeon, vascular surgeons, the anesthesiologists, all have to be trained in order to have a good surgical moment. Also, we have to decide the diameter of the fiber who is going to deliver the photons, and how we have to englobe the total amount of foreign body in order to be removed, and also have the control of the cardiovascular and neurological procedure with protocols for any complication during the surgical procedure. So the conclusion that the photonic approach to assess, diagnose, laser treatment, and follow-up of the tissues that it was damaged by the biofiller are less invasive, highly specific, and save patients to have a larger scar, and give us a chance to make the reconstruction during the same surgical time. But it has to be a multitask team in which everyone has to be the knowledge, not only for the multispectral image, also the Doppler image interpretation. Thank you for your time, and thank you for watching. And this is it.